At an initial consultation, typically there's going to be a number of different components that happen. One thing that's really important is to ahead of time write down your list of questions to make sure that all of your questions are addressed during the consultation.
And are there any underlying problems causing their hair loss?
You were a little bit iron deficient.
At Root Hair Institute, we want to tell them, hey, let's educate you on what's out there, what's going on with you. Let's come up with a long-term solution for you that you can agree to so our goals are aligned.
Often there'll be kind of intake paperwork going through detailed history. You want to complete that as accurately and thoroughly as you can. A lot of things don't seem relevant to hair, but in reality are. The human body is connected, so we want as much information as possible.
And then I'm just gonna kind of feel the hair here, if that's okay.
And then the next component of the consultation is going to be the physical examination. They'll use a scope for magnification to get a really close look at what the hair looks like, what the scalp looks like, make sure there's no inflammation or other things going on.
And then I do see some hairs kind of growing in, which may be those growing in since you've been taking your iron supplements.
A key portion is talking to the patient. So really understanding what it is the patient wants. Do they want hair in a specific area? Do they want to prevent future loss? Do they want to just make sure nothing is wrong internally? There's a lot of different goals that patients have. And then also understanding concerns that they have and what they're okay with treatment-wise, especially with maintenance therapy. The earlier you start on that therapy, the better your trajectory is going to be.
We do take the hairs from here. They will survive very long term. That's what gives us the ability to do hair transplants.
It always goes back to prevention. So we want to prevent the hair loss of the existing hairs that are already there, and we want to complement those hairs with hair surgery, where we take it from the back and the sides. Those are areas of hair which are not sensitive to said hormones that are bad for hair follicles, and placing them in the areas of hair loss. The other thing to consider with the spectrum and timeline of all of this is if you consider hair loss, it didn't just happen overnight. It's happened over the course of several years. So a lot of times what we tell our patients is don't get disheartened. You're not supposed to notice hair coming back within a month or 2 months of use. You need to be on it for 6 months to 12 months to see the effect. And so the turnaround time to getting that hair back and stopping the hair loss is also going to take months to years.
It does look like you have female pattern hair loss. So treatment options are going to be topical. So
it's important that the first thing that be done is to make the appropriate diagnosis, because that's going to determine your treatment options to a great degree. Depending on the type of hair loss that you have, it can be anything from topical treatments, oral therapies, device-based treatments, so laser caps and other devices, injections that are performed in the office, as well as surgical therapy.
There are so many tools at our disposal to treat patients, because the culmination of all of those things coming together will give them a 9 out of 10 or 10 out of 10 solution for their hair loss. But if they just piecemeal choose one or the other, it may not be really effective. It'll be maybe a 2 or 3 out of 10.
Did you have any other questions today?
No, I think you've answered all my questions.
So I think it comes down to taking a good history, physical, making the right diagnosis, and then listening to the patient. We want to come up with a treatment plan that works for that patient and that they're going to be able to stick with long term so that they get the results that they're looking for.
Ultimately, at every step of the way, our motto is growing confidence. We want patients to be educated, and that grows their confidence. We want them to make the right decisions with their medications, and that grows their confidence. And if they do surgery, ultimately, that will grow their confidence. And that, for us, is really our goal. We want our patients to be happy with the outcome.